So it is truly my pleasure to have this symposium. We've been here for 11 years and collaborate with a variety of people. I was thinking in my head how many, probably over hundreds of people in the last 11 years. So what we're hoping is with your brain, your expertise, your energy, your dedication, this is an excellent forum for us today to be able to think what is the next 10 years we can do using the platform we already established and continue on for the work we did together. I think Peter actually already mentioned our main objectives. It is looking forward for the next 10 years. And the way we want to run this symposium is more interactive. The section 1 is mainly in the surveillance area. We have a few perspectives. And then we move on to the second session, which is the cohort activities and understanding the risk factors and understanding immunological markers. And then the session 3 is really something SHIVERS because the platform is running when we had a pandemic, COVID-19. So what we hope, we got really support from Ministry of Health for the National Immunization Program funding, and we would give you some slides presentation about what we are achieved so far. But the first 2 sessions is really interactive. We want to have as lively discussion as possible. So I want to borrow this slide from yesterday's showcase. Really just want to give you some idea about the SHIVERS-I platform. And the SHIVERS-I, we established a hospital surveillance platform, which is in Central Auckland, ADHB, and also Southeast Auckland. Combined, we have about 1 million catchment population, 20% of the whole New Zealand population. And then we have another surveillance platform, is Sentinel General Practice Surveillance Platform. Roughly about 16 practice participate in Auckland, and then roughly 10% of a study population, 10,000 people. And that platform is the platform we run in the 4 hospitals: Auckland City Hospital and the Starship Children's Hospital and the Middlemore Hospital and also Kids First Hospital. And the platform use our research nurses screening all the people coming to the hospital, admitted in hospital with acute respiratory illness, and then case ascertain them, recruit them if they meet the WHO case definition for SARI, and collect lots of clinical metadata, and also the specimen for laboratory testing. And the second platform is the GP surveillance platform, and that is for those 16 Sentinel General Practices when the GPs or the practice nurse see people with the influenza-like illness, and they will case ascertain them. Also, if they meet the II case definition, which is a cough fever, onset within the 10 days, very similar to a hospital. Hospital SARI is they have to admit it in hospital. We collected the data from the patient and also get the sample for testing. So these are the 2 main surveillance. We keep that going all the way till CDC finished their funding around 2017. And we are extremely grateful. And we got continuous support from Ministry of Health for hospital SARI surveillance and also for the GPII surveillance. And this piece of the work is led by Dr. Sarah Jeffrey from ESR. So that is about the surveillance component. And I think the one thing I do want to say is those two platform really set up in New Zealand very well to be able to respond to the pandemic and also to control the seasonal flu. And because those two platforms really produce the powerful baseline data, so we can compare that with any future pandemic virus. So, for example, the GP surveillance platform allows to understand how easily the virus is spread in our community, so understand the virus transmissibility. And the hospital surveillance platform allows to understand how severe a potential pandemic virus will cause. And then they also allow us to understand the impact in the healthcare system, particularly the hospital ICU capacity. So that is our section 1, and that's just a background to set up the scene later on for us to have further discussion. The section, my presentation will cover the section 2, and it is really about the cohort perspective. And today, particularly, we have our sister cohort site from Los Angeles and from Nicaragua, and our Senju colleagues with all the best assays in the world. So we want to have a very lovely, lively discussion as well for the SHIVERS-II, the adult cohort, SHIVERS-III, the infant cohort, and the SHIVERS-IV, the household cohort. And many cohort has lots of immunology objectives and also has epidemiological objectives to understand the disease burden and understand the household transmission dynamics. So these are the one. I will repeat it one more time about the study activities because some of you may not be familiar with it. And if you want to tap into this platform, what is produced, the data and the specimen, the result, that is something potentially you can think about for the future. So our adult, infant, and household follow very similar study activities. Everybody will be consented. We'll have a baseline blood collected. And then during the flu season, we send a weekly survey to the participant, ask whether they have flu-like illness. If they say yes, our research nurse will go through the triage. And then if they meet the case definition, we will collect the swabs for testing. And if they are flu positive, or last year, if they are COVID positive, then we will take a pair of the blood. And if they had a vaccination for flu or vaccination for COVID, we will take a post-vaccine blood as well. The only component very specific for our household transmission, household people is the household transmission dynamic study. So if one index case is positive for flu or for COVID, then the whole family involved in the study and everybody will have swab every third day and a pair of the blood samples and daily symptom monitoring. So at the very end of the season, then we have annual blood collection for the cohort, each cohort members. So because our cohort was running during the pandemic, COVID-19, it allows us to understand the immune response to COVID infection, COVID vaccination, understand the virus transmissibility at the community level, and also understand the virus change, what kind of variant generating. And together with the other platform we are running at the ESR, we're able to understand the impact of COVID-19 related non-pharmaceutical intervention on respiratory viral infection. And we also excited to have Flu Lab funded additional surveillance platform. So we get together, it become really powerful ways for us to be able to understand the impact of the non-pharmaceutical intervention. This is another example that Flu Lab understand our cohort, understand the powerful sample collected, those sera or the plasma samples. And we are in such a unique situation in New Zealand that in 2 years, 2020, 2021, we have no flu. But we have the blood collected. 2022, we have lots of flu coming along. So that allows us to answer the question whether we can use the patient's blood sample to understand what kind of antibody is longer lasting, what kind of antibody when very quickly, that potentially can inform the future universal flu vaccine development. So that is our session 2 later on, combining with the input from our sister sites and from the Senju, we can have a very good discussion. Section 3 actually is mainly about giving you a bit update during the COVID period, how we responded to the COVID. So that will be slides presentation. And it covers 3 objectives. So we promised the Ministry of Health we would deliver. First is about vaccine effectiveness against COVID-19 and using our cohort, which we have about 3,000 people. And then the section 2 is really an epidemiological descriptive analysis on incidence, transmission, and the risk factors among the 3,000 cohort participants. And the third aim is trying to understand the household transmission dynamics and the risk effect and the transmission subcohort. So we have roughly around, this is an outdated figure, and then Nayara will give us a presentation about a much updated study in that area. So what I want to summarize from the SHIVERS perspective for section 1 is I consider SHIVERS platform is really essential for New Zealand's pandemic preparedness and the seasonal control. And also the platform is able to expand it to dealing with the other viruses, the COVID-19 and high impact viruses like RSV. And it is really powerful to do some research as well, not just the routine surveillance. And the cohort from the SHIVERS platform, I think, we have so many samples collected. Really, really exciting to see Paul's presentation yesterday, how it can move up to another level, truly understand what is the immunological mechanism behind it. And we also collected lots of virological samples, the swabs, and that will push us go further to be able to understand, say, genomics area, which is relatively new, and understand how the viruses are related to each other. And our cohort data is also really good, combining with other data to provide us with a much complete the picture of what the virus is causing the disease in our population at the community level. And we can see COVID-19 pandemic really shows that the cohort is useful from that perspective.